Mandela once said that after climbing a great hill, one only finds that there are many more hills to climb. This enhanced partnership is built on trust, shared responsibility, ownership, and leadership. It will have more resources to draw upon than ever before. The commitment of the European Union is to actually keep on this track of collaboration, and we are here as equal partners of yours.
The partnership is between countries in Europe and countries in Sub-Saharan Africa. Partnerships between governments, partnerships between scientists, and partnerships between academics and large pharmaceutical companies, drug development partners, to try and develop new ways of working. And EDCTP provides an infrastructure for conducting clinical trials so that we can provide the evidence whether or not those products really work. We can have high-quality science in the West, but unless we understand the context in which the diseases occur, we're not going to actually achieve the goals that we've set ourselves.
So what we are beginning to see is the real development of capacity on the African continent.
The partnership has promoted and triggered African owner and leadership in running clinical trials in African countries. EDCTP too needs to become more closely connected to health policy, regulators and manufacturers of medications and vaccines, so as that new innovative solutions can be transferred much more quickly and reach the patients in a much more effective way.
EDCTP and the pharmaceutical industry share many goals. It means a lot for us to be here. We see ourselves really as one of the many stakeholders in public health. The successful collaboration between the pharmaceutical industry and EDCTP is when we started setting up the fellowship program, because that will be an opportunity for them to learn skills that you do not learn at a hospital or at medical school.
It would be fantastic if we had found either drugs that treat and completely cure any of the diseases which are on our list. If we develop new vaccines that eliminate and prevent the diseases on our list, we can't promise any of those, but we can set ourselves a high ambition of eliminating at least one or two of those diseases.
This program is meant to align national strategic research programs into one global strategic research program, such that problems that typically cannot be resolved alone are going to actually be tackled together.
Much of the lessons that we learn in South Africa could be translated to the rest of Africa.
So what we are expecting is that there will be closer collaboration. There will be a lot more engagement, right from the way the studies are developed, the studies are formulated, the way hypotheses are thought through, so that this community voice can become a little bit louder.
We will build on work that has been done already. I'm very committed to ensuring we don't start as though we're at the kick-off point. So we should look at concrete outcomes, and then we should identify what are the gaps.
Nous avons énormément de chercheurs très qualifiés dans plusieurs domaines. On parle d'Ebola aujourd'hui, mais nous avons aussi le chikungunya chez nous. Vous avez le monkeypox. Il faut continuer à former ces chercheurs qui existent, ces étudiants, pour qu'ils soient pointus dans ces maladies.
We have become aware that we lack the most important means to combat neglected and poverty-related diseases. So we need global solutions to these global problems.
Unless there is an innovation of the private sector in the pharmaceutical industry, it doesn't become a drug.
The challenge in innovation is not only in the pursuit of vaccines or drugs, it is also about fostering a culture of innovation. The EDCTP2 program, with an increased budget, extended scope, reinforced and extended partnership, gives hope to African scientists and allows us to continue in our fight against infectious diseases.
It's important that if we're developing new drugs or new vaccines, that we get regulatory approval for those in an African context. So we need to be able to convince the regulators as well that we have got the right products. So we have a lot of work to do, and the next 10 years is going to be busy.
Our aim is to boost research and innovation in Africa because we believe we cannot thrive as South Africa in isolation. We need to be part of a vibrant Africa-wide research and innovation system.
To this end, we require close coordination between European and African universities, research centers, and government institutions, backing from international private donors, the involvement of foundations with global health agendas, and expertise in getting different people and institutions with diverse backgrounds in various geographies to work together.
Strengthening capabilities and capacities for health research in developing countries is certainly one of the most effective ways of advancing health and economic development. However, this needs not only the commitment from funders, but it requires political commitment at all levels. You can count on the European Union and the European Commission to be your partner in this endeavor.
Flexibility should be key for promoting fruitful initiatives, but only a strong emphasis on quality and ethical integrity can allow EDCTP to remain as a flagship initiative for Africa-Europe cooperation.
We have to change the character of Africa. It's a challenge that faces us as humanity, because it cannot be that so many who live in the world we live in such dire conditions and circumstances, have no solutions available to them, and live in a condition which science has shown us we actually are able to address. So that when we talk about being partners, it's not a concept, it's a reality.